Good afternoon. Welcome to the daily briefing in the St. Clair County EMA office, where we're bringing you the latest information here with Chairman Mark Kern and, of course, Sam Bierman. Sam, you have the numbers, and we got a lot more to talk about today.
We do. Numbers are a little better today. We are hoping to see even better days through the end of the week and into the weekend. As of today, 29,109 COVID tests have been performed for St. Clair County residents, with 3,270 positive test results, which is an increase of 60 from yesterday. And that does include both males and females from under the age of 10 up to their 70s. Today, our positivity rate is better. We are at 9.4% today, and yesterday we were at 15.9, so we are headed in the right direction. We are at 25,806 negative test results, with 33 results that are still pending, and we currently sit at 149 deaths. We are still in the process of clarifying with IDPH the discrepancy for what they are posting and what we have. So again, as soon as we get that, we will announce that. For those who have completed their IDPH required 14-day quarantine period, we are at 2,263. For state totals, 2,388,193 have been tested, with 166,925 positive test results, which is an increase of 1,624 from yesterday. And for deaths, the state is reporting 7,367, which is an increase of 20 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 43 patients that are admitted due to COVID-related reasons, and one of those patients is on a ventilator. For those who have been tested at the at the Sportsplex location out in O'Fallon for the July 14th mobile testing that was sponsored by St. Clair County Health Department, we are aware that a lot of you have still not received your test results, and please continue to be patient with us. There was an issue with the lab, and we are in the process of rectifying that, and we know that the test results have taken a little longer to get to you. And we are still working on that. As they come in, you will be contacted with your results, whether they are positive or negative. And we ask that you just please be patient with us. We understand that it's a hard time while you're waiting for those results, but we are doing our best to get those results to you as quick as we can. And before I turn it over to Chairman Kern, I just have one other point I would like to touch on. Today is day 133 since starting that we have provided either daily numbers or the EMA briefing. And I know we are probably tired of hearing the, wear your mask, socially distance from others, and wash your hands. But those are three of the biggest keys that we can give people to start slowing the spread of this virus. We, as the rest of the state did, thought we were on a good path when we opened up into the phase that we are currently in. And then we saw people start to relax a little. The weather was nice, school was done, everybody was getting out, and then we started to see our numbers rise again. And while none of us want to regress and move back to the prior phase we are in, we don't know what is in store for us if we continue down the road of our numbers increasing. So as we have said in the past, please continue to wear your masks when you're out in public. If you cannot socially distance yourselves at least 6 feet. To be safe, it's always a good idea to wear your mask when you're out in public in general. Washing your hands when you are done being out in public, or if you don't have access to soap and water, using hand sanitizer. And by doing all those things, I know they seem very insignificant, but if everyone does those things, we will be better off and we will be back to normal sooner.
Well, Sam, I sense a little disgruntlement in your voice, and rightly so.
And it's yes and fear for us.
Yes.
As we've seen COVID progress since the beginning. In the beginning, we saw that it was hitting our older population, our more medically vulnerable population. But now by looking at the numbers, we see that it's starting to hit that middle-aged, really between like 25 and 45. We're seeing that population hit even harder. And while they might not have the medical issues that the older population had, that doesn't mean that it still doesn't knock you off of your feet. That doesn't mean that, just because you're in that age range that you can't spread it to members of your family. So, while we have learned some things from COVID from the very beginning. There is still much to learn, and we need to take it just as seriously now as we did in the beginning. So
Very good.
I
Thank
think
you.
today 60% of the people who are COVID positive in our numbers today are under 40. So that seems to be the group that may not be getting the message.
And
So-
we're seeing that shift. Before, like you said, it was higher, and now we're starting to see it lower. And more often than not, now we are seeing under 10 on our age groups for those that have been positive. I remember when we had the very first one, it was a shock to all of us, and now it's seeming more common, and that's the last thing we want. The older and the younger are the ones that have the hardest time fighting off this virus.
Well,
Okay.
that's why I'm glad you're here fighting. And, so statewide, the positivity number is about 3.4%. Here in our region, which is St. Clair, Madison, and Clinton, Randolph, and Monroe
Monroe
counties,
counties.
we're 6.9%. So we're twice the state average on positivity. That's why we got to do better.
And even though we fall under what we consider, our cap for the positivity rate, we don't want to just be under it by a percentage point or two. We want it to be as low as possible. So, if you see that even though we fall under, we want to be as low as we can. It's not good enough just to be under the cap. We want to be as close to zero as possible.
Great.
So,
Thank you, Sam.
absolutely.
You've got a lot of energy since you were off for a couple days, and now you're back in full swing.
Ready
She
to go.
answers as many phone calls while she was off as she does
I
when she's
know.
working.
That's not a whole lot of time off. Well, we'll move into the zip code report for today. This is the normal time we do that. As always, I'm going to read the number of new positives in our particular zip codes in St. Clair County, and then we talk about the increase in each zip code. Today, I think in all but 4 zip codes we have increases, so we got a lot of changes today. In 62059, we went up by 1 to 9. In 62201, we went up by 1 to 165. In 62203, today we went up by 4 to 123. In 62204, we went up by 2 to 98. In 62205, we went up by 1 to 125. 62206, we went up by 11 today to 293. In 62207, we went up by 3 to 179. In 62208, we went up by 9 today to 196. In 62220, we went up by 3 to 263. 62221 went up by 4 to 282. 62223 went up by 1 today to 130. 62225 stays the same at 12. 62226 goes up by 7 to 334. 62232 stays the same at 69. 62239 goes up by 1 to 27. 62240 goes up by 2 today to 9. 62243 went up by 1 to 20. 62254 went up by 2 to 109. 62255 went up by 1 to 9. 62257 stays the same today at 19. 62258 went up by 3 to 42. 62260 went up by 1 to 32. 62264 stays the same at 63. 62269 goes up by 8 to 203. And 62285 remained the same today at 27. So we've had discussions this week about schools, and it seems to be a very popular topic with parents out there wondering what's going on in the fall. A lot of different decisions are going to be made throughout all of the districts in the county, and we are dedicated here to try to bring in as many of the viewpoints of the varying districts, the recommendations that each of them are making. Today, we've got a special guest. Art Culver is here. Art is the superintendent of District 189. And Art, I understand you have made some decisions today, or have made decisions about the fall for students and with your school board.
Yes.
And so welcome, first of all. I appreciate
Thank
you being here
Thank
today.
you, Chairman Kern.
So how is school going to look as of now? How are you predicting school's going to look for your students in the fall?
Well, it's with a heavy heart, I had to I will be recommending to our board that there's no way that we could have any kind of in-person instruction. And it's based on those numbers that you've just announced. And unfortunately for District 189, those numbers have been escalated in the wrong direction at a rapid rate. In St. Clair County, we did the math. We have approximately 40% of the cases in St. Clair County are from zip codes that we serve. A lot of people think it's just East St. Louis, but we actually serve 11 zip codes. And again, 40% of the positive cases reside in the zip codes that we serve. So knowing that, and also knowing that we have over 560 students with underlying health conditions, asthma, diabetes, heart issues, and so forth, and many staff members with underlying health issues, it would be irresponsible for us to try to have any kind of in-person instruction. Again, I'm saddened by that because we worked so hard this summer with a group of parents, teachers, administrators, the union, community members. We've been working, looking at a hybrid model that we really thought would be successful. But after looking at the data, there's no way we can attempt that. It would be putting too many people in harm's way.
And I know you've been working with Liz Patton at the Eastside
Yes.
Health District.
Yes, we collaborate with her weekly. As a matter of fact, she let us know about a week ago that because of the spike in the cases in our serving zip codes, that they would not even be able to do their health clinics if we did open up. And also, they do some dental screening for us, and they pulled out of that also. So it's alarming. It's really serious in East St. Louis, and we felt like this move would help us to try to break the chain of the transmission in the zip codes that we serve. We know that if we have kids at school, there's going to be more contact and more positive cases.
So you have been working and preparing. So
Yes.
Maybe in anticipation, maybe because of your of a viewpoint that this might happen, a lot of the students from last spring kept
Yes.
the equipment over the summer.
Yes.
And so you'll be able to distribute equipment then to new students and to the incoming freshmen.
Yes, the students that left our school district, that graduated, they did return their equipment. We were fortunate in that at the beginning of the last school year, we had enough Chromebooks to issue every student. So we had Chromebooks for kids K through 12. Now, we did do a survey with our parents, and 80% of them said they don't need the technology. What they do need, though, in some cases, parents don't have internet access because of the infrastructure in their neighborhood, specifically in Washington Park, mainly. So we've been working with community members, of course. So we've been working with AT&T, Spectrum, Charter Spectrum, and MediaCom to try to resolve that issue. Well, that's not going fast as we would like it to go. So what we've done is we purchased from AT&T what we call these mobile hotspots. Mm-hmm. So any family, we want families in East St. Louis in our serving zip codes to know if they don't have internet access, let us know. We have a hotspot device that we can let you use. And those weren't cheap. They cost about $50,000 a month just to keep them active so that they'll be able to get the internet access. And they do have protection devices on them so that students won't be surfing the web in places that we don't want them to be.
Well,
but that money is well spent because education is the lifeblood of any community. And our kids certainly know that we know that education is going to be the key thing that could give them a shot at a much better life.
And so is that CARES Act dollars that we'll be paying for that?
We did use, that's a good point, we did use CARES Act dollars. The first 3 months, they gave us a deal. We bought 1,000. They cost $50 a piece. We purchased 1,000. And for the first 3 months, we paid $170,000 for the internet access for the first 3 months. But now, starting in July, it's $50,000 per month. But to keep them active, but it's well worth it. Our kids are anxious to learn, and we don't want them to be hindered because of their zip code or because of their economic status. So we're fortunate that we did receive about $7.4 million in CARES dollars, as well as some other funds from the state, some intervention funds that will help us to make sure that our kids have everything they need. Now, we did do a survey, as I mentioned, and one of the things that came out in the survey was that some teachers did a really good job. Most of our teachers did a superb job with the virtual learning, with the remote learning. But there were some cases where parents indicated that it could have been better, could have been a better quality. Sometimes they felt like teachers may have needed a little more support from technology department, which of course we couldn't send technology department to their homes. So what we're going to ask our teachers to do this time is that students won't be at school, however, teachers will and other support staff. We feel like it's easy to distance staff members, so teachers will be in school during their lessons. In most cases, they'll be video taping those lessons using Google Classroom. And I think the experience for kids will be much richer and they'll get a lot more out of it. And then also, if they're having technology issues, we'll have our technology support staff there on the ground ready to jump in and help and make sure that experience is a good one for the teachers and the kids. Another advantage to having teachers together, they can collaborate about students, about how to do certain lessons. So we feel like that collaboration and that experience where they're in the building together is going to benefit instruction and is certainly going to benefit our kids.
And you didn't have a whole lot of time last spring.
We did.
When you found out that kids weren't going to be coming to school, you maybe had 2 or 3 days to come up with a curriculum.
Yeah, we were learning on the fly. But I tell you what, we've studied, we've learned so much from this. We've purchased a lot more equipment that we need to get this to do it the right way. And we feel like the experience for both teachers and kids, especially kids, is going to be much better.
It sounds like a neat plan. So you're actually going to film the video will come from the teacher in the classroom. The students will see the teacher as they would have had they been there.
That's right. And in many cases they'll watch them live, but we know some of our kids, they have 4 and 5 siblings. And sometimes the oldest student may be helping the younger student. So they may not be able to see that lesson as the teacher's doing them live. So if they're not filmed, they're going to be caught without having that direct instruction. So with them being taped, kids can go on when it's convenient for them, when they don't have to help their younger brother or sibling or work or whatever the case may be, and they could see that video of that lesson when it's convenient for them. And also kids may see it the first time but need a refresher. So if they need remediation or more enrichment, then they can click on that video then too. We just think this is going to be the best way to provide the best education possible for our students. Now we know remote learning is not as good as face-to-face learning. That's why we made the decision to go remote only for the first quarter, the first 9 weeks. We'll continue to look at the numbers and track the data, and as soon as that we feel it's safe to bring kids back in with a hybrid model first, then that's what we're going to do. But right now, we know that the governor's goal, I think, for phase 4 is 50 positive cases per 100,000 residents. Well, in East St. Louis, we have 81,000 cases. I'm sorry, 81 cases per 30,000 residents. Chicago has 58 cases per 100,000 residents. We're at 81 per 30,000. If you do the math and do the conversion, that would put us at 270 positive cases per 100,000 students. So we're by far the highest infection rate in the state of Illinois. And we're 5 times more than what the governor's goal is for phase 4. So we're just going to be responsible, be safe. Education is important, but it's not as important as health and safety.
But it sounds like with your plan that education is going to go on.
It's going to go on.
And that there are
It's going to go on.
that all the opportunities are there
Yeah.
to be able to get that kind of quality education that
Exactly.
you're used to offering.
Exactly.
every
And
day.
then we do have special needs kids, just like all districts do. So we're going to have our IEP committees meet on every kid that has an IEP, the individual educational plan. And in some cases, it may be recommended by that committee that some of those kids come in for some in-person instruction. That will be a lot easier to manage than having half of your population there or your entire population at school. But again, those decisions are made by the individual educational planning committee, and we will certainly abide by whatever decisions those committees make.
So what about music programs, sports programs, the extracurricular activities?
Yes.
Do you have anything on those?
Yeah, music programs. There are a band and choirs, and they can do a lot of things remotely. They did this past spring. Did a great job with it. Sports. We're following the guidance of IHSA, and that is changing and evolving daily. Matter of fact, I think there's a meeting tomorrow with IHSA, the Illinois School Board, or members of the Illinois School Board staff, as well as the IDPH, Illinois Department of Public Health.
And they're considering maybe just doing all the sports in the spring.
That's what I'm hearing. I don't know if any decisions have been made, but I'm hearing that they may move all the sports to the spring. Honestly, based on what the numbers are, the numbers that you read, the numbers that I've discussed also, for us, I think that would be the best thing to do for this county. I really do.
Well, your plan really sounds first rate. I think it's taken a lot of thought. So you'll be taking that to your school board?
School board tomorrow for a vote. And again, this was just not the administration making this recommendation. We had a committee of teachers, parents, community members, administrators, and everybody decided that, this is the best thing to do. And again, we're locked and loaded, and we're going to do a much better job than what we did in the spring. We did a good job, but it was thrust upon us so quickly that we had to fly the plane and work on the plane at the same time.
Right. And it would, the things we've learned, we haven't learned everything about
Yes.
COVID-19, but we certainly have learned a lot since you made those decisions back in March.
Thank you. One thing we have learned, Mark, is that it's serious, it's unpredictable, and it's evolving.
And it is
I was alarmed
contagious.
when I heard you talk about the age population that's catching COVID now. Initially, they said it wasn't affecting young people that much, but now I guess things are just evolving, and that's understandable because it's so new. But I think it's going to take everyone in this county to do what it takes, as someone mentioned earlier: masks, social distancing, washing hands. That's the only way that as a community that we're going to break the chain of this transmission. It can be broken, but it's going to take everybody uniting and working together and following the experts' advice. The medical doctors, the scientists, they know more than all of us know. So we shouldn't be second guessing them, in my opinion.
Don't second guess Ms. Patton.
No way. I will not.
Herb?
Brian, you got a question or two that came in?
Yeah, there's a couple that have come in. The first one
Yes.
said, is there any consideration being given to your teachers or staff that might have children of their own in the district that they would now have to take care of?
There certainly will be, and we're going to look at that on a case-by-case basis.
Okay. And the second one that came in and said, for parents who work that have children in your district,
Yes.
is there any considerations for any type of all-day latchkey or programs for the younger students?
Good question. We do have a 21st Century grant, which is an after-school grant to keep kids after school. But we've also been connecting. We have a lot of good community partners. Leslie Bates, I'll forget some, of course. Chet Cantrell with the Christian Activity Center, Jackie Joyner Kersey. But we have a lot of, and then the east side of the line, we have a lot of community organizations that are just chopping at the bit to see how they can help. And some of them have told us that if families need assistance with childcare, that they're ready to step in. And we're going to make sure that they do that safely, where there's social distancing, where there's not too many kids. And honestly, I was telling our staff today that if it requires that we take a look at our facilities and if families need help, we certainly know that the economics for the families is important. Families need to work. If we cannot connect them with a community center, then we can provide something in our district. Because we have a lot of good facilities, we can certainly social distance, and all of our staff are being paid. And that's why it's so good that we have a good relationship with our union. I talked to the union president just a couple of days ago, and I told him we're going to keep everybody on the payroll. At one point, we kind of considered, should we lay off people that we may not need? And then we got to thinking about it and said, well, we do have the CARES money, so we can pay them, but we want them to be willing to go outside of their job descriptions to make this work for kids. And our union president said, without a doubt, you can count on us, we'll be there to do whatever you need us to do, as long as we have masks, there's social distancing, and we're not putting people in harm's way.
Flexibility.
So, flexibility. And that's what it takes, though. Cooperation, collaboration, everybody working together, and forgetting about your normal job description. We have right now, this summer, with feeding kids, we had security guards feeding kids, bus monitors delivering meals. So everybody's just willing to step in and do what's necessary to meet the needs of the kids that we serve. And that's really what education is all about.
And that kind of leads to the last question
Yes.
that was posted here is there any intention or possibility of continuing the lunch program during this time?
No doubt. It will be continued, without a doubt.
Okay. That's everything that came in.
Very good. Superintendent, we really appreciate you
Thank
taking
you.
time to come
Appreciate
here
it.
today.
Good job.
Enjoy it.
Appreciate it.
Thank you so much. I appreciate it.
We appreciate that plan. I think that's
Sure.
gonna
We're
work.
going to make it happen. We have to.
That's it.
Yeah.
good.
Hey, can I get a copy of those numbers?
You sure?
I'm
We
asking
can
too
copy
much.
anything you want.
Okay. Well, thank you.
Very good. Thank you.
Appreciate that. Yeah, those numbers. I want to update mine because I see that. Pardon me? Okay. I see that the numbers that I have, they've gone up a little bit.
Yeah.
My numbers are a day old though.
Well,
Yeah.
ours are fresh.
Yours
Hot,
are fresh.
hot off the press.
Hot off the press. So if I can get
Barely
those
touched
numbers,
the
that'd be
paper.
great. Yeah.
Very good. Thank you.
Thank you.
Well, Chairman, a lot of good information, and I think the program of having the superintendents come in really eased a lot of tension throughout the county. We started the day off with a conference call with the mayors, and I know several of them already have sent out letters to business owners, and I want to thank them. I showed you one from the Belleville Mayor O'Fallon is drafting one up, and all of them this morning, they appreciated the I want to say the pep talk we gave them, because they've all been with us since day one on this. And here we are 133 days into this, and it seems like it's a broken record. And before I go on, we could really tell Sam is concerned, as she said, and getting a little feared about it, but she forgot to mention that there was no changes in the long-term health care, so she slid me a note, and we won't hold that against her.
No.
But we all get stressed, and I know you have, I have, but I just don't know. We want to keep that positivity rate down, as we told them this morning. We suggested again that the police chiefs and the fire chiefs they get out there and do some public service announcement. Bringing in people like the superintendents, I think, is just showing the commitment. We're trying, but it's a community, it's a county effort to do this.
It's a Team St. Clair effort. And, if there are businesses that are doing it right, let people know that. You can share that on
Sure.
our Facebook page, on your Facebook page, anywhere. If there's an entity that's doing this right, let people know
We
about
want to
it.
know that, yeah.
Because that's where we want to go. That's good business, I think, to do this in the right way. It really is good business.
Well, and as we talked this morning, and we want businesses to stay open, but we want them to be responsible. And so, as you're saying, for you people that are following the page, if there is that restaurant out there that's following the social distancing, or the bars, whatever it may be, the beauty shops, the barbershops, let us know. We're going to put that out there. We get questions all the time. One lady last night said, I went to the hardware store and they got a sign on the door that says mask required. And when I went inside, none of the clerks had masks on. Well, that's your choice if you want to go in there and shop. We want you to support them, but we want them to be responsible. So make a phone call to the manager of that store and tell them, I don't feel comfortable coming in there. So we can't do it all for you. And then tomorrow we're going to have another assistant superintendent, Nicole Sanderson from Wolf Branch, will be on with us, telling us what their school plan is going to be. But before, and I know you watch the page, and we have still a percentage of people out there that want to be the naysayers, as I call them. And first, I want to thank Team St. Clair, every one of you who have been team supportive. Everybody who has just spread the word about wearing the mask, wash your hands, watch the social distancing. We can't thank you enough. But if one of our followers, a good Team St. Clair member, Mike, posted something today that I thought was really interesting, and it really sinks in. So I think sometimes visual, and Randy, if you can get a shot of that, I'm in a very caring way today. And Chairman, we've been in it 133 days, so I've got about 100 pieces of candy here. But the naysayers that follow this page and the naysayers out there, even across the country, say that the kill rate of this virus is only about 2%. And I've got about 100 pieces of candy there, and I've got 2 pieces in there that are deadly. If you bite one of them, it kills you. Help yourself.
Not I.
Well, and you're a smart man. And I would hope that each and every one of you naysayers, and nothing personal, but please wear a mask, watch social distancing, and wash your hands, and don't eat that 2 pieces of candy that could kill you. Because when you go out in public and you're not wearing that mask and you're not washing your hands and you're not doing social distancing, you are gambling not only with your life, but whoever you're around. So I will take these candy, and any of you naysayers who want to come to my office and reach in there, I'll be more than glad to let you. We'll be back in a few moments with Cindy and Daisy to translate this into our Spanish community, and I'll make sure they don't reach in there and try to get a piece of that candy. And then we'll be back tomorrow afternoon at 3:30 for the next update. Thank you.